Okay, welcome everyone who's online for our JDI Roundtable on Manufacturing Competitiveness New Brunswick webinar. I'd like to welcome this morning to a presentation we're going to have on COVID-19 guidelines for New Brunswick manufacturers from Sarah McRae, who is our postdoctoral fellow at the Roundtable on public policy, and Johannes Doemer, who's the occupational hygiene, health and safety expert with WorksafeNB, who will be here to add input and support as well. I just want to note that the goal of the Roundtable on Manufacturing Competitiveness is to create better conditions for manufacturers in the province to get to export and hopefully to grow the economy. And with the pandemic coming on fast, we've been looking at just what do we know about best practice and how manufacturers around the developed world are trying to get back online and get producing. And so Sarah has been busy trying to keep up with an ever-changing body of evidence. It's almost as close we've ever had to a live document. And so I would like to welcome Sarah and invite her to begin presenting. I would just like to note that there is a live question and answer session where you can type your comments, and then those will be presented to Sarah and Johannes at the end of the presentation. We expect the full event to run 1 hour, and we look forward to the slides coming up, Sarah.
Okay, thank you, Herb. I just want to note, as Herb mentioned, questions are welcome, and there will be a Q&A session at the end of the presentation. I would just suggest that you note here on the slide, if any problems with the Q&A function arise, jot down this phone number, 506-292-0720, to text your message to Mayor Mallory and then she can convey those to Johannes at the end of the presentation. So in this presentation, we're going to cover a few things. So this stems from research done for a report that was sent along with the invitation to this webinar that covers recommendations and best practices, as well as official guidance from New Brunswick businesses, from the Chief Medical Officer of Health, as well as WorksafeNB. It looks to case studies for examples of best and worst case scenarios and what we can learn from them, as well as recommendations from other sources such as CME, the WHO, and various industry leaders. So first, we're going to look at a couple of case studies that show potentially how things can go wrong, as well as how measures such as early interventions can prevent outbreaks in the processing and manufacturing sectors from getting out of hand. So the first example that I'm sure most of you have already heard of and potentially been following is the Cargill outbreak in southern Alberta. So outbreaks in food processing plants have already drawn international attention, and they're being closely watched as case studies of what could happen if proper protocols aren't put in place early in plants where physical distancing isn't possible, as is common in the food processing sector. The Cargill meat processing facility near High River in southern Alberta is now the worst worksite-related outbreak in Canada. On April 13th, the plant's first 38 cases of COVID-19 were brought to the attention of media. At that point, a provincial health and safety inspector conducted an inspection over video and concluded this plant was safe to remain open. But 2 weeks later, as of April 25th, the facility had announced plans to pause its operations, as there were at that point 558 confirmed cases and 1 death. As of May 9th, the plant was the location of North America's largest outbreak tied to a single site and had been linked to more than 1,500 COVID-19 cases in the community, close to 950 of which were workers. The plant reopened on May 4th, with operations reduced to 1 shift and new safety measures introduced, including reducing the likelihood of carpooling by providing buses with protective barriers between seats, to transport workers to the site, adding barriers in the washrooms and reassigning lockers to allow for more spacing between them. Protective barriers have also been installed on the production floor, and face shields have been introduced in places where barriers are not possible. The media has also been reporting on outbreaks at other food processing plants such as JBS Canada Beef, also in Alberta. Other smaller processing sector outbreaks have been reported at various poultry plants throughout Canada as well. So some New Brunswick manufacturers and processors have been operating this entire time. Unfortunately, the province has seen no workplace-related outbreaks. The province's manufacturing and processing sectors have an opportunity now to emerge as a best-case scenario for manufacturing and processing in Canada. But stories like these show that it's important to carefully adhere to official guidance and keep up to date on the latest recommendations and best practices to ensure the sector is ready to prevent something similar from happening here. So just something else I'd like to draw your attention to, because I know that many seafood processing plants are looking at reopening now after a delayed season. Case studies in the sector are especially important. So a common theme in the seafood processing sector so far has been early intervention to emerging outbreaks. For example, on April 20th, Highlighter Foods temporarily suspended all production at its Portsmouth, New Hampshire location. The seafood, and this was due to, at that point, less than 10 COVID-19 cases. It said the plant would remain closed until the company had conducted a deep cleaning and contact tracing. In response, Highliner Foods made masks mandatory for workers at its Lunenburg, Nova Scotia location. The facility also introduced staggered shifts in Lunenburg, rearranged tables in the cafeteria to increase spacing, added 16 sanitation stations, and assigned a worker to clean surfaces on a full-time basis. The company said that, as of May 1st, a temperature screening device would be delivered and installed to test workers. Similarly, in Oregon, Bornstein Seafoods shut down 2 plants at the Port of Astoria on May 4th, and that was after 11 employees tested positive. So far, seafood processing plants have fared better than meat processing plants, but this may have to do with fewer plants being in operation due to seasonality. Still, the outbreaks at these plants haven't taken off to the same degree as we've seen in the meat processing sector. And it seems safe to say early intervention in these cases played a role. The above plants shut down after approximately 10 cases, compared to the Cargill plant, which didn't pause operations until it had over 500 cases. That said, the Cargill plant still had to pause operations eventually, after the spread of the contagion had already taken off at an accelerated pace. So that being said, before we get into more broad guidance, it's very important for New Brunswick manufacturers and processors to understand what is legally required of them based on the official guidance that's in place in our province. So WorksafeNB has published general guidance for businesses operating during the COVID-19 pandemic. All businesses operating in New Brunswick are legally required to take every reasonable step to adhere to these guidelines, which includes steps to follow when physical distancing requirements are not feasible. So it should also be noted that workplaces in the province are also required to come up with an operations plan detailing all the measures that they're taking and have that ready to share with public health at any time. The WorkSafe guidance follows a basic hierarchy of controls related to COVID-19. First of all, businesses should take every reasonable step to ensure minimum interaction of people within 2 meters of each other, and that's including in vehicles. Employers should ensure that proper hand washing and enhanced sanitation and cleaning practices are enforced, especially in areas where multiple people handle things like tools, goods, and other equipment. The hygiene aspect of this guidance should be possible for everyone to follow, but in some instances, such as food processing, distancing isn't possible at all times. In that case, the next step in the hierarchy is the installation of physical barriers. Examples of this would include plexiglass or wooden partitions or even plastic curtains. In cases where physical barriers are not possible or limited, active screening is required. It should be noted that WorkSafe recommends active screening for all businesses, but it is required when physical distancing and physical barriers can't be accomplished. So there'll be more on what this active screening entails in a bit. In addition to these screenings, employers should practice enhanced cleaning and sanitation protocols and ensure available PPE as appropriate, such as non-medical masks. Interaction should still be minimized as much as possible. So for the rest of the presentation, guidance from WorksafeNB will be addressed on a per item basis. So based on the review of existing recommendations and best practices, a few key themes emerged that I'll use to organize the rest of the presentation. So those themes are adjusting operations to allow for physical distancing and to reduce the number of contacts for each person, employing active screening and other safety measures when physical distancing is impossible, preparing for a fast and thorough response to outbreaks or possible outbreaks, and ensuring clear and ongoing communication of expectations. The first theme mentioned here is adjusting operations to allow for physical distancing and reducing the number of contacts. So as mentioned before, this presentation, The most common recommendations revolve around adjusting operations to facilitate the required 2-meter distance between workers where possible. This is usually positioned as a first step, as being able to do this effectively may reduce the need for other measures that require purchasing and installing materials such as barriers, PPE, and temperature checking technology. Doing this might mean rearranging floor plans, slowing production lines, or staggering shifts over a longer workday. For some firms, it may be feasible to resume operations incrementally and at a slower pace to allow for better distancing between workers and to allow for adjustments to safety protocols as needed. Measures such as staggering shifts, ensuring staff stick to the same shift each day, and arranging staff into smaller work groups can also reduce the number of potential contacts for each person. This can pay off in the event of a COVID-19 case among your workers. Canadian Manufacturers and Exporters, or CME, has published a guide to workplace social distancing best practices for manufacturers. And this is a really valuable resource. I'd recommend that you have a look at it. You can find information on how to find this research in the full report based on this presentation that should have been attached to the email that was sent out inviting you to this webinar. Another resource consulted in this presentation is provided by Learcorp, which is a Michigan-based automotive parts supplier with 271 production plants in 39 countries. It published a detailed handbook for reopening its manufacturing facilities while minimizing the potential risks in getting back to work. And that's also another valuable resource. So some general on-the-floor guidelines that came out from the CME and Learcorp guidance included recommendations, first of all, for general hygiene and safety. This could include adding hand sanitizer stations to high traffic areas and marking a wait line 6 feet from the station to ensure appropriate spacing. This would also include expanding cleaning and disinfecting activities beyond eating areas and considering making high traffic areas one-way. So a lot of these recommendations are valid across sectors, the same things that we've seen in retail spaces, etc. Another common recommendation is staggered shifts and time clocks. Learcorp suggests start times of shifts should be staggered. For example, you could divide employees into separate groups, and in one scenario, Group A could enter between 6 and 6:10, and Group B enters between 6:15 and 6:20, allowing that little space in between for disinfecting. Employers should look at revisiting punch-in and punch-out procedures, evaluating whether it's necessary to use physical time cards, and whether arrival times could be staggered to avoid crowding. Employers can prop doors open at shift change to minimize door handle touching. In fact, they could do that throughout the day if possible. The same staggering method could apply to breaks to avoid crowding of spaces. Employers may also revise the number and length of shifts. For example, running 2 longer shifts instead of 3 would reduce traffic and allow time for proper sanitation of equipment and other facilities between shifts. In terms of workstations, where possible, manufacturers should adjust work areas so workers are spaced at least 6 feet from each other. This may mean spreading shifts over a longer day or adding an extra shift. Suggestions from Lear include using production transfer aids, such as inclined shelves or push boards, to minimize the risk of social distance violations. Conveyor lines should have operator boundaries clearly marked on the floor. In terms of shipping and receiving, employers may look at staggering deliveries or arranging for contactless delivery where possible. In the maintenance shop, firms may look at reducing or eliminating the shared use of tools and/or ensuring tools are disinfected between uses. Eliminating shared work tables and benches is also recommended. In break rooms, in addition to staggering break times, which may require longer break windows, employers can use tape or signage to indicate 2-meter spacing in seating, or simply remove chairs that you don't want employees to use to indicate the appropriate amount of people that should be in a space at any given time. Firms should also have a strategy for high-touch areas like microwaves and vending machines, such as assigning a single person to operate the microwave, or simply having additional sanitation materials on hand and guidance for how to use them. Half of a crew could be asked to eat outside or in their cars on alternating days, so there's ample social distancing for employees who remain in the lunchroom. In bathrooms, change, and locker rooms, ensure an adequate hygiene product supply, and post hand washing and cough hygiene protocol signage in visible areas, importantly in languages that reflect the workforce. And lastly, in the office, all personnel that can work from home should of course be encouraged to do so. The World Health Organization has posted some guidance as concerns the food processing sector specifically, but some of these rules can be applied more broadly to the manufacturing sector in general. These include staggering workstations on either side of processing lines so that food workers are not facing one another. Spacing out workstations, which may require reduction in the speed of production lines, and organizing staff into working groups or teams to reduce the number of contacts per person. This could be as simple as ensuring that workers are limited to the same shift. For example, night shift workers can't switch to day shift, and would also mean that the number of potential contacts would be reduced in the event of a COVID-19 case. So just a couple of images to show some measures that you can take in the workplace to promote social distancing. These images come from a document released by JD Irving recently, showing the COVID-19 protocols that it has put in place for its offices and manufacturing plants. That's another valuable resource that will be cited a few times throughout this presentation, and that you can find linked in the report that was sent around prior to this webinar. So one thing you can do is in bathrooms, simply taping off every other sink to ensure proper social distancing. In break rooms or meeting rooms, indicating the capacity of the room using signage. So the next theme that emerges throughout the guidance available for manufacturers revolves around employing active screening and other safety measures such as physical barriers when physical distancing isn't possible. Some sectors like food processing have to deal with work environments where it's not always possible to keep 2 meters apart. So firms should do their utmost to ensure the safety of their workers, which may mean providing barriers between workstations and or face coverings or face shields. Active screening is also an essential measure for employers who cannot ensure physical distancing. WorksafeNB recommends screening for all workplaces, but active screening is required in cases where physical distancing cannot be maintained and a physical barrier cannot be installed. So a little bit more about these barriers. Firms can install physical barriers between workers, such as a clear plastic guard. In the images on the screen, on the left is an example of a meat processing plant who has employed a fairly low-tech plastic barrier installation between workstations. Employees in this instance are also equipped with face masks for additional protection. On the right is an example of a floor-to-ceiling wood or plexiglass installation that JDI has used at some of its workplaces. So as concerns active screening and temperature checks, if installing a barrier between employees is not possible, WorksafeNB states that all persons entering a workplace must be actively screened for symptoms of COVID-19. So WorkSafe says the screening process must include temperature checks, provided a non-contact thermometer is available. But manufacturers may have to adopt interim or additional measures, such as verbal screening protocol. No-touch infrared scanners, for example, can vary from forehead thermometers, such as the one pictured in this slide, to high-end maintenance cameras with a setting to monitor human temperatures. Other tools exist, such as disposable thermometers. In the case of unavoidable periods of close interaction with other persons, WorkSafe says the active screening activity, including temperature checks, should be conducted for all employees at the start of each shift and repeated not more than every 5 hours after that. Any person showing COVID-19 symptoms must not enter the workplace. Those showing symptoms mid-shift must immediately be asked to leave the workplace and dial 811 for instructions. Regarding masks and face coverings, WorkSafe's return to work guidance states face coverings are mandatory as an additional measure to protect employees, clients, and visitors when workplaces are not able to ensure 2 meters of physical distancing. The New Brunswick Chief Medical Officer does not recommend the use of N95 respirators or surgical masks by people who have no symptoms, but the use of non-medical face masks, face shields, and or fabric face coverings is recommended in situations where physical distancing isn't possible. So the picture shown here is again from the JDI document, and it shows on the right a plexiglass face shield that it's using for employees that must work in close quarters. So that's one idea. Another note from WorkSafe is regarding record keeping. So WorkSafe's return to work guidance states employers should keep visitor and employee logs for access points in rooms where physical distancing is not possible. Employers may consider electronic records, and I know that there's more and more programs and technology available facilitating that, but this can be as simple as keeping a physical log. And having this basic information on hand, even if recorded using low-tech means, may be essential in helping public health perform contact tracing in the event of a COVID-19 case in your workplace. So just a couple of extra images showing what a temperature screening station may look like. So JDI's recommendations alluded to earlier include a self-assessment sign at the entrance that asks basic self-screening questions based on guidance issued by the Chief Medical Officer of Health, which I should note is updated regularly and needs to be consulted on an ongoing basis. The document also includes some detailed descriptions of temperature screening tools, such as infrared cameras of varying levels of sophistication. It also includes images of its setup and supplier information for the particular models it uses. So moving on to theme 3, which is preparing for fast and thorough response to outbreaks. So as demonstrated by the case of Cargill's meat processing plant in southern Alberta, one case of COVID-19 among workers can quickly turn into hundreds if a plant or factory doesn't intervene quickly and effectively to an outbreak. Manufacturers and processing plants should therefore develop response plans for dealing with the early stages of an outbreak in tandem with public health. WorksafeNB has outlined what should happen if an employee is tested for COVID-19 or has close contact with someone who is being tested. The common theme is letting public health take the lead in following their instructions, but there are some instances where employers must make their own decisions of how to respond to employee contact with a possible case or traveler. So working through the WorkSafe guidelines, if anyone who has been exposed to someone who has been diagnosed with COVID-19, public health is advising them to self-monitor themselves for 14 days. If a coworker has close contact, then they must self-isolate. In either case, if the worker develops symptoms for COVID-19, they need to isolate and use the Government of New Brunswick's assessment tool to assess their status and next steps. If an employee comes into close contact with someone who is being tested for COVID-19 but is not symptomatic themselves, they must self-monitor and check with their employer if they prefer them to come into work or remain at home. If an employee is living with or coming into contact with someone who has returned from travel outside New Brunswick who is not symptomatic, they should self-monitor again, and again, discuss with their employer whether they should come into work or remain home. In terms of protocol following 14-day isolation, employees who have completed the mandatory 14 days of self-isolation following travel or close contact with a case should be considered healthy if they show no symptoms. No doctor's note is therefore necessary for returning to work. If an employee was self-isolating because they were under investigation by public health will provide a letter to the worker and employer when the worker is able to leave self-isolation and return to work. So just a note here for employers based on the above, the WorksafeNB guidelines direct asymptomatic employees who have had contact with someone being tested for COVID-19 or with someone who has traveled outside the province to ask their employer whether they should report to work. So this means employers need to develop their own internal protocol for responding to these questions. Moving on to possible or confirmed employee COVID-19 cases, if an employee is being tested for COVID-19, WorkSafe says the employer should assume that the test may come back positive. While awaiting results, they should clean and disinfect any areas where the employee has been in contact. And if possible, they should close off the potentially contaminated areas until the test is confirmed. The employee should self-isolate and await instructions from the Department of Health. If the test is confirmed positive, the employee must follow the advice provided by public health. If an employee tests positive for COVID-19 and may have had interactions with coworkers before diagnosis, the employee must immediately isolate themselves, and public health will advise anyone who has been exposed to someone diagnosed with COVID-19 and identify any control measures that are required to be put in place. So moving on to protocol for symptomatic workers. So first of all, employers must ensure employees are trained to self-monitor for symptoms and not report to work if they are symptomatic. Ideally, with the screening protocols described previously in place, a symptomatic person shouldn't enter the premises. However, there should still be protocol in place for dealing with an employee who becomes symptomatic during a shift. In New Brunswick, the first step is calling 811 and adhering to guidance from public health. Additional protocols should include strategies for immediately isolating workers and who are showing symptoms at the workplace, including having arrangements for sectioning off contaminated areas and conducting a thorough disinfecting of the premises, as well as preparing documentation of team members who have had contact with an infected person. So further guidance from other sources includes more tips on on-site isolation of symptomatic workers. Lear Corp, for example, mentions having an on-site isolation protocol in place, including a designated isolation room and PPE for the isolated person and those interacting with them. Lear also recommends communicating with the affected employee to make a list of all areas they have been physically over the last 3 days and closing these areas off using plastic sheeting if feasible, and ventilating the area to the outside. Lear also recommends having a deep cleaning and disinfection protocol in place for when an active employee tests positive for COVID-19, which should include identifying an external company with personnel trained to execute the process of cleaning, disinfection, and disposal of hazardous waste. Another recommendation is using small teams and work groups. So to reduce the impact of a symptomatic worker, the World Health Organization emphasizes the importance of organizing employees into small teams or work groups, which will help minimize disruption to the workforce in the event of an employee reporting sick with symptoms of COVID-19, by reducing the number of contacts that person would have had. So a further note on facilitating contact tracing through working groups and record keeping. As the above guidance shows, being prepared to trace all close contacts of an affected employee is essential to preventing an outbreak from spreading. This means employers should have accurate documentation of which employees have been in contact so they can properly share this information with public health should the need arise. As mentioned in the previous section, having working groups or setting consistent shifts and not allowing employees to switch between shifts would help facilitate accuracy of contact tracing. Organizing shifts further into smaller working groups or teams, as recommended by the WHO, would further reduce the number of close contacts per employee, which would also mean reducing the level of disruption in the event of a confirmed case. Employers may want to have a record-keeping system in place to track coworkers who have had close contact. So finally, the last theme that emerges is the need to ensure clear and ongoing communication of expectations. It sounds very basic, but it's incredibly important. So given the abundance of information circulating about COVID-19 health and safety, best practices in the workplace, it is essential that employers are aware of their responsibility to clearly articulate protocol and provide training for adhering to new expectations in the workplace. This includes keeping up to date with public health recommendations. Further, employers should keep employees informed of protocol for what they must do if they show symptoms at or outside of work. In addition to training documents and signage, individual employees should be aware of what exactly is expected of them as individuals within the new guidelines. For example, employers may need to be specific in providing protocol for things such as the frequency of hand washing, how often specific surfaces need to be disinfected, expectations for shared spaces such as lunchrooms, and what to do about things like smoking breaks or carpooling or any other instance that might result in close physical proximity. It's also essential that communication is ongoing, and frequent verbal reminders and other reminders may be required. Supervisors should have clear guidelines as well for how to perform checks to ensure that distancing and hygiene guidelines are being followed, including how often these checks should be performed. The Canadian Centre for Occupational Health and Safety has released a document containing tips for manufacturers that covers much of the same protocol contained in the WorksafeNB guidance, but it also emphasizes the importance of clear communication about expectations and protocol for employees. It recommends, first, make sure workers know about the virus itself, how it works and how to minimize its spread. Next, set a clear policy for what is expected of workers if they get sick or if they have symptoms, or if an exposure is reported. Further, provide adequate information and training regarding sanitation procedures and the safe use of PPE. Provide reminders about COVID-19 prevention, signs and symptoms, and make sure workers are trained to work safely before replacing the duties of others. This was a really basic overview of some of the findings from the research I performed surrounding recommendations and best practices for manufacturers. Of course, the situation and guidance is evolving as people learn more about COVID-19 and how it spreads. So I'd recommend keeping on top of updates from public health and WorksafeNB. So as mentioned at the beginning of this presentation, you can submit questions via the Q&A function to be answered. We have Johannes from WorkSafe here, who can answer some of your specific questions about what's recommended.
Hi, Sarah. I do have one question for you and Johannes. Do we know what the person taking the temperature at less than 2 meters should be wearing as PPE or for protection while taking the reading, especially if it's not a registered nurse?
Do you want to answer that, Johannes?
Good morning. Yes, I can speak to that. Because typically the temperature reading has to be taken within 2 meters. The applicable requirements apply for this. In terms of PPE, that would mean mandatory face covering and determination of the PPE per employer risk assessment. So that would speak then to eye protection and hand protection. The current guidance is that the employer has to do a risk assessment for those interactions and determine the level of PPE for those items on a case-by-case basis.
Okay. Can you, I know that WorkSafe came out with some additional guidance this weekend. Johannes, do you want to touch on the WorkSafe requirements that were released in the last few days?
Yes, I can do that as well. And Sarah mentioned the operational plan, which is likely the largest update on this. WorkSafe has published a new guidance document called Embracing the New Normal that addresses the reopening in the current phase for New Brunswick, but is also applicable for all workplaces which continue operation and which never close down. One of the significant requirements in there is that an operational plan has to be developed and implemented at the workplace. In other words, if public health or public safety or ourselves, WorkSafe New Brunswick, inspection occurs, we would want to see the operational plan. Now that guide, as I mentioned, also contains a template for that operational plan, and following in this presentation, if you follow the recommendations presented in this presentation, the operational plan will be very straightforward for you, because it has been naturally developed for all workplaces in New Brunswick, not only manufacturing. And if it really is a tool to document the measures that you have, if you already have them in place, and a tool for workplaces, if they reopen and they don't have the measures yet, a tool that can help them to develop and implement those measures. However, that operational plan needs to be in place. Other than that, the specific requirements that have to be addressed were reflected in this presentation. What I would encourage you and everybody actually at the moment is to do your best to try to stay up to date with the information and the guidance and the requirements, because this changes very rapidly. An example for that is the mandatory face coverings, which were introduced in this weekend. And public health has also changed the position on full face shields in this regard. So public health does not accept full face shields as an equivalent to face coverings, which means they cannot be used alone in situations where 2 meter distancing is not possible. That, for instance, was an update I received yesterday, and that just illustrates how quickly information changes. And we expect workplaces, of course, to, well, in our language, always take reasonable steps to stay up to date.
So does that mean that a workplace that has been using face shields, they would have to have face shields and face masks, or is face masks the standard?
Face coverings are required for 2 meter interactions, so for interactions within 2 meters, and that is mandatory. The face shield can be used and is used as recommendation for further protection of the person who's wearing it. But a face shield, the reasoning behind this is that there has been no evidence that a face shield protects the persons around the person who's wearing it. And that's the intention of the face covering. So then they don't have quite the same purpose, and therefore public health doesn't accept them as equivalent anymore. However, we still recommend, if you have face shields in place, use of face shields. You can also wear them over the face covering, of course, and it's still beneficial for the person who's wearing it, but not as much for the people around this individual.
Okay, so face shields are to protect me. My face mask is to protect you.
Yeah, in a nutshell, yes.
Got it. What services are available from WorkSafe? Oh, just a second. I have a question from Herb here. Is there an expectation that these measures with COVID, which impact, let me just open this, my apologies. Oh, I will ask this. Is there an expectation that these measures with COVID, which impact capacity utilization and operating costs, are temporary? Example, are these going to last a year or two, or are these looked on as permanent?
That is a very good and very valid question, I guess. At the moment, the government, I guess, is planning in comparatively short planning cycles, of course. The phase approach for the reopening is based on 2 to 4 week windows, and that is based on the incubation period of the virus. In other words, if we make a mistake now and open too far, we only would see the result in 2 weeks, not earlier. It is expected that some limitations and some requirements related to COVID-19 will be in place at least until a vaccine is found. And obviously, it's difficult to put a timeline on that. But it is also expected that if New Brunswick performs as well as thus far, that further lifting of limitations and potentially requirements will come in the future. So it's very difficult to answer in terms of specific requirements, because those are really the decision on those follows very tight timelines. Let's put it that way. Does that answer the question at all?
I think so. Next question concerns what constitutes reasonable steps on the part of the employer. How often should the employer review the WorkSafe New Brunswick, Health Canada, and Government of New Brunswick websites to satisfy due diligence? And I'll just add another part of that question. Is there one source of information within New Brunswick that is compiling the requirements from all those parties, and is there a one-stop shop for manufacturers that they can check and satisfy their due diligence requirements?
Yes, at the moment, the one-stop shop I would recommend is, in fact, the WorkSafe New Brunswick website. The aforementioned Embracing the New Normal guide has been developed in consultation with the other agencies, so with public safety and public health. It contains all the up-to-date requirements at the moment, and will do so going forward. At least that's the expectation. Any major changes will be communicated also on the WorkSafe New Brunswick website, of course. And if there's significant changes that employers need to be aware of, it will be communicated through that platform. So I would recommend, obviously I'm biased in that way, but I would recommend the WorkSafe New Brunswick website as the go-to source. For general information, the GNB website is also very useful, but really as it comes to workplaces, you find the most up-to-date information from WorkSafe New Brunswick, and that is also the information that we would expect you to be knowledgeable of and to be compliant with.
So how frequently should they check it? I know that updates are happening fast and furious right now, but is there some form of regular update cycle that WorkSafe is going to start to implement, and that employers can satisfy their due diligence requirements by ensuring that they check those updates at that frequency?
I can't give you a precise answer to that, again, because information changes so quickly, and some of that is also out of our hands. Of course, some of the decisions regarding reopening are being made at the highest level of government. including the time frame of entering the next phase, for instance. And obviously, once that happens, then WorkSafe would react and put the necessary information online. Last week was a good example. The new phase was announced on Friday, I believe. It was fairly clear that it was coming a couple of days in advance. But the new phase was announced on Friday. A new mandatory order was issued on Friday, and as a result, the guide I mentioned was also published then on the same day on the WorkSafe New Brunswick website. In terms of time frame, I know this doesn't satisfy much of the answer for the time frame. In terms of time frame, the mandatory order has to be reissued at least every 2 weeks, and that's per legislation. So at least every 2 weeks, you can expect either a minor update to the mandatory order or simply that it's being reissued. So typically, and that's what we've seen in the past, typically major updates to the mandatory order fall into that kind of same time frame, every 2 weeks, or maybe every week at the moment towards the end of the week.
Okay. So you're talking, when you were referencing the mandatory order, you're talking about the order, the legislative directive that the Premier and Public Health put out, which is the foundation of the manufacturer's legal requirements to comply.
That's correct. So the mandatory order, or the declaration of a state of emergency, as issued by the Minister of Public Safety. So that is the legislative framework that at the moment everybody in New Brunswick is working from, including WorkSafe.
Yeah, the comment saying that it's a good idea for the employer to include the frequency of updates in the operational plan. That's true. That's just having that as a regular, and demonstrating that. In your experience, Johannes, what's the largest challenge for New Brunswick's manufacturers? Is it just the frequency of change, or is it the 2 meters distancing? What are you hearing from New Brunswick employers?
It is, of course, the challenge of trying to keep up with the information and with the requirements. That's what we hear a lot. New Brunswick manufacturer, what I've seen, have adopted very well, and were some of the first ones to embrace this challenge, so to say, including installation of physical barriers and including trying to find effective solutions for their operations. So that was nice to see. I would say still trying to stay up to date is probably the biggest challenge at the moment, and hopefully now that we are entering again the second phase of reopening, it will calm down a little bit in that regard, but we'll see.
If there's any other questions from listeners, feel free to submit them via the Q&A function. Johannes, I'm thinking of the amount of barriers that some manufacturers will potentially have to install or are installing in their factories and in their firms. I'm assuming these physical barriers all are also additional surfaces that have to be disinfected at regular intervals. Are there particular products or standards of disinfectants that WorkSafe requires?
WorkSafe, as well as Public Health, currently references the Health Canada list of approved disinfectants and sanitizers. So you can find that information both in our FAQs, I believe, as well as online at Public Health Canada. So there's a list of approved products for that purpose that you can refer to. And it also gives you guidance in terms of bleach products, for instance, which can be used for that purpose. In terms of physical barriers, what we recommend is installing physical barriers that are easy to clean and easy to disinfect, of course. But that's more from a maintenance perspective.
So can people actually install physical barriers that are, you know, like I'm thinking office dividers, those kinds of things? They're fabric often. I'm assuming that is not. Well, I'm not assuming anything actually. Is that a kind of physical barrier that you can install as well?
It depends on the work setting, but in general, yes. I think in the FAQs we actually addressed the question of when can office cubicles or cubicle walls be used as separation and under which conditions. For manufacturing setting, I always recommend to ensure that whatever material you choose is can be effectively cleaned and sanitized. And then it really depends on your workplace and on your work reality and what we can utilize in that regard. But obviously porous material is not as great for sensitization and for cleaning. But maybe if you're forced to use that, maybe you can put a liner on top of it that is non-porous that can be easily cleaned as an example. Yeah.
Question, when was the last renewal of the mandatory order and when is the next renewal due?
The last major one was Friday. I think there was a minor revision yesterday or today. It is always difficult to project when the next one will be. The next major revision I would expect in a couple of weeks. Sorry, it's already Thursday. So in a couple of weeks from last Friday. So it means in a week from now, approximately, if there's one.
I have a question about when the presentation will be available online afterwards. I will be posting these slides, the guidelines document, and this presentation is recorded. So I will be posting the recording of this webinar. I will send notice of the posting out to the original list of who requested attendance at this meeting, and you can feel free to distribute that to your teams. I have another question about the consequences of non-compliance. So how is compliance being monitored? What are the consequences of non-compliance with the mandatory requirements or guidelines?
No, compliance to workplace health and safety requirements, as you know, follows the Occupational Health and Safety Act and will do so. So not too much change in that regard, just that we consider now, so to say, from a Health and Safety Act perspective, we consider following the recommendations from public health and following the requirements that we have put out and online as reasonable steps for employers to follow. But compliance with those is required, is enforceable, and will be enforced as necessary. That is from our perspective. Public health and public safety inspectors and officers also have the right to enforce the mandatory order, and will do so also in workplaces, especially in public-facing workplaces. Of course, that's more their focus than let's say a manufacturing environment. That would still primarily be WorksafeNB. But nevertheless, especially when it comes to the operational plan, all those three agencies have the right and would require that operational plan to be in place and in effect, and have the right to take a look at it and examine it. We have been in our enforcement approach, especially when it comes to the operational plan, it's fairly clear. If a workplace does not have an operational plan, it cannot operate.
Okay. I have a question about long-haul trucking. Long-haul trucking operators are exempt from isolation procedures. When a firm receives goods from international shipments, can we assume that any passive or active screening has been done by the drivers or the driver's company, or should the receiving company be doing that screening?
Now, I have to qualify that a little bit. The long-haul trucking operators are exempt from self-isolation requirements. That is correct. They do still have requirements to follow in terms of isolation while being in the province, such as minimizing the contact to New Brunswick residents. This does not necessarily change much in terms of your workplace's procedures. You still have the obligation to ensure that reasonable steps are in place, that nobody enters your workplace who has symptoms, for instance, etc. So I would advise you that, let's put it this way: use caution when you try to rely on somebody else's screening process. If these individuals actually enter your workplaces, you're responsible for the screening and to ensure that screening occurs.
Okay. Question, in your opinion, do you see manufacturers having to keep barriers up post-COVID?
Post-COVID?
Yeah.
To be honest, I haven't thought much about post-COVID yet. As I said, I'm pretty sure that some of these requirements and some of the measures that workplaces have to have in place will remain for quite some time, until we find a vaccine at least, and then we'll have to see what the situation is and what the real new normal looks like. But I mean, that's a time frame that is difficult to envision at the moment, at least from our perspective, because we just don't know yet how that disease will, so to say, establish itself in the world. So is that something that we have to worry about also 3 years from now, similar to other diseases that so to say are established diseases, or is that something that we can actually completely get rid of by thorough vaccination of the population, in which case we wouldn't have to worry about COVID-19 anymore in 3 years from now, and there wouldn't be a need for any of these measures. But it's really difficult to project that and to predict how, quite frankly, the world is gonna look like in a year or a couple of years from now.
Okay, so we're 2 minutes away from from our promised end time. Are there any other questions out there? Just submit them through the Q&A if there are. I'll wait.
Maura, I have a quick one.
Okay.
Just about how. So we're introducing regulations to deal with COVID. Is there any consideration being given as they're set what other jurisdictions are doing and making sure that we're not putting undue burden on manufacturers, or are we still too early in the process to be worrying about regulatory harmonization?
Yeah, I wouldn't call it regulatory harmonization yet. There is consideration of what other provinces are doing, what the federal jurisdiction is doing, etc. So there is consideration of that, of course. We're taking a close look at, or let's say the different agencies are taking a close look at the situation, the progress, and some of the measures in other provinces as well. But because of the different situation in different provinces, I wouldn't call that harmonization yet. At the moment, if you look at some of the guidance and what's happening at the borders at the moment, New Brunswick is trying to conserve the good situation we have within the province right now, for instance, by strengthening the borders and by limiting more travel into New Brunswick. So I don't think we are at the point yet where we really think about the harmonization. we're taking a look at the different approaches from different provinces and see what works and what doesn't work, and try to draw the necessary conclusions for procedures and requirements within our own province. Maybe I'm speaking a little off my scope here, but I don't think there's too much concern about a Canadian harmonization yet. That will come though, I would think.
Thank you.
Okay. So thank you very much, Sarah and Johannes, for the presentation, the Q&A. This is really helpful. For everyone still on the line, again, I will be posting this recording. So if there's some additional people within your organization that would benefit from this, please feel free to share. And if you would like to receive updates about the JDI Roundtable and the other webinars that and events we'll be putting on, please look us up on the UNB website. We're at blogs.umb.ca/AIPR. That stands for Atlantic Institute for Policy Research. So it's blogs.umb.ca/AIPR. And you can sign up to receive our newsletter from that site. So thanks very much for joining us, and we will let you go on to your lunch.